Hi everybody, Dr. Jody Kinney Chiropractic. Today I want to talk to you a little bit about shoulder pain. That's one of the most common conditions we treat in our office is people who struggle with shoulder pain. So shoulder pain is going to occur in something like 70% of the population at some point in your life. The shoulder joint is a ball and socket joint. It is the most movable joint in the body because it can go in 360 degrees of rotation, flexion, extension, across the body, all the way up and around. So there are a lot of muscular attachments, tendon attachments, ligament attachments, so it's really very easy to injure or hurt your shoulder because of all the muscular attachments in the front, in the back, all the way around. When you get shoulder pain, or when people come to me with some sort of shoulder pain, the pain can refer anywhere. They can tell me they have pain that goes into their chest, or pain that refers down into the arm. Sometimes pain refers up into the neck or in between the shoulder blades. And those all could be sources of coming actually from the shoulder joint. Acute pain is something that lasts from maybe a day to a couple weeks. Chronic shoulder pain can last from a couple weeks to several months, perhaps up to a year. But more than half of shoulder conditions tend to resolve in about 8 to 12 weeks. 40% or more can become chronic and can go on to be lasting longer than a year. So it's important to get it checked as soon as you have pain, as soon as you have problems. Poor posture is a very common cause of shoulder pain. When you round the shoulders and the upper back, that puts a lot of stress. Those rounded shoulders forward puts a lot of stress on those shoulder joints. So it can cause problems. If you have poor posture, it can cause problems in the shoulder joint. Other common causes of shoulder pain include repetitive stress. If you're a manual laborer, you do repetitive shoveling, digging, hammering, whatever overhead work, that can give rise to wear and tear on the shoulders. A lot of my athlete patients who are repetitive stress athletes, like swimmers or pitchers or football players, hockey players, anything where there's can be stress on the shoulders will definitely cause shoulder pain. Blows or traumas, accidents, slips and falls where you take a blow to the shoulder, that's definitely going to give rise potentially to shoulder problems. Often people believe they have shoulder pain when the cause is actually coming from the neck. So it's really common because the neck refers nerves that go to the shoulder and all the way down to the arms, hands, and fingers. It's common for neck pain to be thought of as a shoulder problem or coming from the shoulder. So a thorough examination and often x-rays is necessary so we can actually figure out what the cause of the shoulder pain is. Now, treatment of the shoulder, especially in the beginning, if it's a new type of injury, is always going to include ice and rest, immobilizing it just immediately so that we don't do further damage. Ultimately, once we get to the root cause of what's happening there, we can incorporate stretching and strengthening exercises and often manipulation or adjustments. So I adjust many shoulders in my practice because often the shoulder joint can become out of alignment or misaligned, just like your spine can become misaligned. And this problem is not going to go away on its own. It has to be addressed so that we can get that shoulder joint back into proper alignment and get proper motion and movement. And chiropractors specialize in adjusting misalignments of the shoulder. So finding the root cause of the problem is always essential to figuring out what the course of treatment is and how we're going to manage anybody's shoulder pain or shoulder problems. So if you're struggling with shoulder pain and don't want to be living in pain anymore, come in and get yourself checked out as soon as possible so that we can get your problem fixed and we can get you to live without pain. All right, thank you so much. Hope that helped. Look forward to seeing you soon.